Welcome back to the channel. Today we're looking into a condition that causes intense joint pain and affects millions of people worldwide: gout. From what it is, why it happens, how it presents, and most importantly, how to treat it. Let's get into it. Before we begin, this video is for educational purposes only and not a substitute for medical advice. Always consult a healthcare professional and verify information with trusted sources. Gout is a type of inflammatory arthritis caused by the buildup of monosodium urate crystals in joints and soft tissues. This happens due to hyperuricemia, which means there's too much uric acid in the blood. It typically follows a pattern with 4 stages: asymptomatic hyperuricemia, acute gout flares, intercritical or in-between periods, chronic tophaceous gout. When uric acid levels exceed 6.8 milligrams per deciliter, it can crystallize, triggering an intense inflammatory reaction. So what exactly is uric acid? It's the end product of purine metabolism. Purines are found in foods like red meat, seafood, and alcohol. Unlike many animals, humans don't have the enzyme uricase, so we can't break uric acid down further. Hyperuricemia can result from too much production, like in cancer or enzyme defects. More commonly, it's from not enough excretion, especially in people with kidney issues or those taking diuretics like thiazides. A gout flare comes on fast and furious. It usually affects one joint, most commonly the big toe, known as podagra. You'll see redness, swelling, intense pain, and warmth over the joint. It might even look infected, and some patients have a low-grade fever. In chronic cases, patients can develop tophi. These are visible chalky deposits of urate crystals in joints, under the skin, and even in the ear. To confirm gout, the gold standard is joint aspiration. Under the microscope, you'll see needle-shaped crystals that are negatively birefringent under polarized light. Serum uric acid levels can help, but they may be normal during a flare. Imaging like X-rays might show rat bite erosions in advanced disease. Gout can mimic other joint diseases. It's important to rule out septic arthritis, especially if there's fever or multiple joints involved. Also consider pseudogout, which has calcium pyrophosphate crystals, or autoimmune diseases like rheumatoid arthritis or psoriatic arthritis. During a flare, the goal is to reduce inflammation and pain. Treatment options include NSAIDs like indomethacin or naproxen. Colchicine works best if started early but can cause GI side effects. Corticosteroids, oral, intra-articular, or IM, are also effective. Avoid starting or increasing uric acid-lowering medications during a flare. That can actually make it worse. Once the flare settles, focus on prevention. That means adjusting diet, reducing alcohol, red meat, and sugary drinks, reviewing medications like diuretics or cyclosporin, and encouraging weight loss and hydration. If a patient has 2 or more flares per year, tophi or kidney stones, it's time for urate-lowering therapy. The goal is to bring uric acid below 6 milligrams per deciliter. Treatment options include allopurinol, a xanthine oxidase inhibitor. Start low and go slow, especially in kidney disease. Buxostat is another option, but use caution in patients with heart disease. Probenecid increases uric acid excretion, but isn't suitable for people with kidney stones. Pegloticase is a last resort that breaks down uric acid directly, used in severe cases. And remember, when starting urate-lowering therapy, use low-dose colchicine or NSAIDs to prevent flare-ups. Monitor uric acid levels every few weeks while adjusting medications. Also monitor kidney and liver function. For special populations, avoid NSAIDs in chronic kidney disease. Watch for drug interactions in the elderly. Post-transplant patients on cyclosporin may have higher risk. Gout is incredibly painful, but also very treatable. With accurate diagnosis, proper management, and a few lifestyle changes, most people can live flare-free. If you found this video helpful, give it a thumbs up. Subscribe for more content on rheumatologic diseases. And drop your questions in the comments. I'd love to hear from you. Thanks for watching, and take care of those joints.